Welcome to the Let's Talk series. The Let's Talk series is a 30-minute video discussion between Dr. Becca, Dr. Amanda, and a local practitioner who understands pelvic health on topics pertaining to women's health and wellness. This series was created to help women navigate their pelvic health wherever they are on the path of womanhood, to advocate, navigate, and collaborate together with a holistic team of allies. Pelvic health healing is multidimensional, and the best outcomes occur with a team-based approach. We invite you to tune into our monthly series to learn more about your pelvic health and engage with our community partners. So welcome to Dr. Stephanie from Dynamic Chiropractics. Today, Dr. Stephanie is going to be talking about, chiropractic care in general and how it's a form of healthcare for all ages, stages, conditions. And specifically how it can relate to prenatal chiropractic care and with breech babies as well. And then just, it's more than just neck and back pain. So we're super excited to have Dr. Stephanie. She is a South Jersey native growing up in Blackwood, New Jersey. She has always had a love and passion for health and wellness and knew she was a doctor of some kind. So she started seeing a chiropractor herself when she was 16 years old for cluster headaches and felt the benefits just overall from chiropractic care. So she knew in her heart this is what she wanted to do with her life and serve people. But like most of us, wanting to be done with school. So she, went through a couple of years of going through, maybe a different path, but then just felt that fire for change, followed her heart into chiropractics, and decided at the age of 29 to go back to school, which is incredible.
Way to go.
Yeah.
So Dr. Stephanie focuses on prenatal and pediatric chiropractic care in her office in Morristown, New Jersey, with her business partner, Dr. Caleb. So thank you for being here, Dr. Stephanie. We're so excited to chat with you and kind of hear more about prenatal chiropractics. I know we share a lot of clients together and are always kind of, as our clients are coming in during pregnancy, they're like, what else should I be doing? And we're always kind of, I think, pelvic floor and chiro are
100%. Yeah, totally.
Clients are like, I'm seeing my chiropractor weekly or that sort of thing. So it's just great to have you, as someone in our community who is helping to serve this population. So
absolutely. Thank you so much for having me. So
you're so welcome.
Yeah.
So go ahead and, kind of jump into, chiropractic care in general, but then specifically kind of during pregnancy.
Yeah, absolutely. So in my office, we see everyone, all families, any age and everything like that. So like you said, I primarily focus on pregnant women and our little babies. And so no matter what stage of pregnancy women come in, we absolutely love to take care of them and educate them and kind of guide through. So I do see, honestly, more first-time moms than any, which was a surprise for me because I also hear a lot of the time that they don't even know they can see a chiropractor. Like they're afraid and they don't know, but then they just have this back pain and they're just, their bodies are changing and they don't know what's going on and they don't know what they can do to help it. So with pregnant women, I utilize a technique specific for that called Webster technique. I did some extra training through our association to learn these very specific techniques, different things to focus on for our pregnant women. And so we do recognize that this is like a very sacred time in a woman's life and it's sensitive. So that's why another reason why we use this technique. It's very gentle, it's very specific. So we utilize relaxing and getting some of the muscle tension to calm down, as well as some adjusting. So if there are segments or anything that needs to be adjusted, my table is designed so that the belly piece actually drops down. So as women continue to progress through their pregnancy, they feel absolutely comfortable. Most of the time, women are just like, can I just lay here? Can you just like shut the door and let me lay here for a few minutes?
They love being able to lie on their
absolutely
belly.
Yeah. And so my table modifies so that as the belly grows, there's more space. So mom doesn't feel like she's squishing the baby or anything like that, but also feels safe and protected. My table also has, it's a small drop system. And when we do some adjusting to whether it's the hips or the sacrum, it does a reverberation essentially through the joint to help things kind of settle where they're supposed to be. And that is after we do a lot of muscle work, ligament work between like the piriformis, glutes, the psoas muscle is a really big one we work on. And then a really other big one is the sacrotuberous ligament, which is a big ligament that attaches from your sacrum to your almost your sit bone, the bone that you kind of sit down on. And so we really like to get all of that to, be nice and relaxed. Because I mean, any pregnant woman will tell you that if you're wearing pants that are too tight or anything like that, baby's like, get away. And we really view the same with the lower pelvis. If there's muscles that are too tight, ligaments that are too tight, baby just doesn't want to go there. So we deal with a lot of that, and we do adjust the entire spine as well, just to make sure that there's no issues going on or could occur in the future, because the body is ever changing through pregnancy. So, sometimes it's the low back, sometimes it's like between the shoulder blades with all of the, change in your curvature and things like that. So if there is ever anything going on within the lumbar spine, I use an adjusting instrument. And so we have two different adjusting instruments in my office. One does like a single click. It's very gentle, very specific. The other one does a rapid vibration. Most people are like, I have no idea what that even is. It almost feels like a little massage gun, but it's very small and specific, because we never want to put any heavy pressure through the belly area. So we use adjusting instruments, and they're just as effective. They're just more gentle. And it does the same thing, like a reverberation through the joint to help things settle to where they're supposed to be. What else?
I think that was helpful, because I really, people will call us and say, do you gals do the Webster technique?
Right, yeah.
And I'm like, I don't think so, but in some ways we probably do similar, like muscle, like we touch similar areas, if you will, but it's really neat to know like that Webster technique is for those specific things post or prenatally. And is the Webster technique known to like help baby turn? Because a lot of people will call us at that week 36 and like, baby's breached or baby's transverse.
Right. So we definitely get that a lot. And unfortunately, I can't say that Webster technique is designed to help baby flip. Webster technique is designed to help mom's body function better, so that baby can kind of move where baby needs to be. Our bodies are designed to do this. Right. And I think we sometimes forget that. And so if everything is aligned spinally, hips, sacrum, but then the muscles and ligaments are functioning properly from side to side, baby will go where baby needs to be. So it is useful and helpful, but we don't flip babies. I know a lot of people say, my chiropractor flipped my baby, and I'm like, no, we worked on your body, and your body did what it was supposed to do. So we definitely see a lot of that. And I do feel bad for moms coming in. I have moms coming in at like 30 weeks, and they're like, my baby's breached. And I'm like, you got time. It's okay. Right. You're here, and we're here to support you through this whole process, because it is scary, especially when moms are like, this is my birth plan, and this is what I want to do. And I just feel it in my heart that that's what should happen. And so however we can support that, we do. So breach is definitely something we see pretty regularly within our practice. Because like I said, when those lower pelvic floor muscles and ligaments are really tight, baby's like, I ain't going there, and they crawl right up into like mom's ribs, and mom's like, my ribs hurt, it hurts to breathe. I'm like, yep, baby does not want to come down, and we're going to work on that to help relieve that rib pain and help you breathe a little bit better, but also help baby drop down a little bit, make things nice and loosey goosey for them to kind of sit where they're supposed to.
So in your assessment, how do you kind of, pregnant woman kind of walks in, what sort of things are you like looking at or looking for that would lead you to say like, oh, okay, let's take a look at the ribs, or, kind of do more at like the sacrum or the pelvis?
Sure. So through our process, our analysis process, I rely on looking at a patient's feet specifically, which doesn't almost make sense to some people. But when a patient, pregnant or not, lays on our table, we look at their feet, and I would say 9 times out of 10, there's a leg length discrepancy. And people are like, oh my gosh, my leg is too short. And I'm like, no, no, no. It's a reflex within the body that happens. And so we'll look at that and see what the legs look in extension and then in flexion. And so wherever those changes happen, kind of dictate where we're going to look first. So whether it's the sacrum, whether it's the iliums, but we also do a lot of motion palpation, things like that, just seeing how the joints move against each other. And then a lot of muscle palpation. So if your sacrotuberous ligament is tight on one side, that tells me your sacrum's kind of shifted, because that ligament is so tight over here that your sacrum probably needs to go the other way, or, you know, things like that. So we do some ligament release and things like that as well. But there are times where things get a little bit tricky, where I'm looking and I'm feeling and I'm just like, I don't know what's going on with your body. And so we look at other things when things get a little bit complicated. I shouldn't say complicated. When your body's not directly telling us what's going on, because your body tells us 100% what is going on. We do look to other areas. Another big area that we look at is your occiput. So essentially your skull. When that shifts out of place there, so you know your brain, your spinal cord comes through a little hole in the back of your head, and there's tiny little ligaments that attach from that bone directly to your spinal cord and kind of hold it like in the middle of the bones. And so when your occiput shifts out of place, because it can move in all different directions because they're sitting on condyles, it creates like torsion because it's directly attached. And when it shifts out of place, it's almost like twisting a string at the top, and the string kind of twirls all the way down. Not that your spine twirls all the way down, but it creates a little bit of torsion through your entire spine. And so we'll adjust the occiput, and people are like, oh my gosh, my hip pain is gone. Things like that. So when things get a little bit tricky and your body is like just really not telling us what's going on, we definitely look to the occiput too, to help clear things out. Just because if there's torsion through the entire nervous system, things just don't work. And typically we see that if somebody has had like a big fall, a car accident, or some sort of sickness, or some like very emotional trauma that's going on, and their body just kind of holds onto that tension in different parts of their body. So
tailbone pain.
Yeah.
Like when we don't know exactly, like it's not, you know, direct at the sacrum or the ilium. It's like, okay, check tailbone. And then we feel a little bit of what's happening at the top of the spinal column as well, to feel like what that nervous system tension feels like. So that's awesome to know that you're also looking in those places with your magical hands and your mindset.
Yeah, absolutely. So yeah, after, you know, we're in my office, we're not an office that's going to tell you you need to be in my office 3 times a week for the next, you know, 6 weeks and things like that. We're definitely a visit by visit office. And so once we get you out of an acute situation where, you know, women are coming in and they're like, my hip, we really like to focus on like a maintenance phase where we do, you know, just general adjusting, still a lot of the Webster technique, muscle, ligament work and things like that, just to keep their body functioning appropriately. Because also, you know, outside of just getting them out of pain, we also want to make sure their entire body is functioning properly, from the joints moving appropriately, but also there's no pressure on nerves, things like that, which those nerves innervate our uterus and those muscles and our intestines and things like that. So, you know, focusing on a lot of that so that everything just works the way it's supposed to and doesn't, you know, hinder any progress through labor and delivery.
So true. Yeah, I think definitely. I think so many people think of like chiropractors like, okay, you go in, it's like they crack your back or they crack your neck, and it's I always, whenever we're referring to a lot of our chiro friends, I'm
Mm.
like, it's not that.
Right.
Just, you know,
Right.
it's a lot more than just that. And I think even just kind of touching on how all of this influences your nervous system, which then influences like all the other systems in your body. It's
Sure.
really a way to kind of, you know, just create that like holistic approach. And I think as pelvic floor therapists, we're constantly, you know, thinking about how their nervous system, the GI system, the endocrine system, like all of those things intertwine and will affect someone's pelvic floor health, but also just any chronic pain that they're experiencing as well. And so,
Oh, absolutely.
yeah, a lot of times things that we're doing, you know, some of the manual techniques, while it may not be specifically like, oh, we're going to release this trigger point, it's how is this kind of affecting the nervous system and just like input to the brain that allows a shift to kind of happen somewhere that then allows that muscle to kind of like, you know, do, you know, release or get that breath into that area where they were struggling to kind of breathe into before. So I think it's super interesting talking about that for people to understand that like it's not, you know, oh, we're just going to adjust your spine and like you're just, you know.
Right. Absolutely. Absolutely. And I think over time, a lot of people do start to understand that. I mean, there's definitely that part of our community, which is everywhere. That's like, I just want an instant fix. But sometimes it's more than just like a one adjustment. Actually, all times it's more than just one adjustment for somebody to fully get out of pain, no matter what degree of pain they're in. And so just, you know, like I said, we're not going to be aggressive with treatment plans, things like that, because also there's a degree of, you know, dedication from our patients. So, but once they start under care and they're like, oh my gosh, I've noticed this, this, and this, especially with our pregnant women, excuse me, who, you know, they're like, you know what, I didn't say this before because I was a little embarrassed, but like I've been dealing with like constipation, things like that. We work on the psoas muscle a lot. And so they're like, oh my gosh, like I feel so much better. I'm able to have like regular bowel movements now, because we forget that our intestines sit right next to that psoas muscle, you know, and if that muscle is tight and constricted, it's going to almost like impede on the intestines and the, you know, exit of our bowels sometimes. So we definitely get a lot of that type of stuff where people are, you know, afterwards like, oh my gosh, I can't believe, you know, those type of things. Even we get a lot of people who are like, I don't take my acid reflux medicine anymore. And I'm like, you never even told me you take it, you know, things like that. So we love when people are very self-aware and they notice those types of positive changes in their life. Between
the unexpected
things.
results, like that's not something that they were necessarily coming
on
in
a line
for.
for that.
Right. Where people will be like, I had the best poop ever. Like,
yes. Or it was like,
Absolutely.
or people go home and they're like, oh, I was intimate with my partner and it was the best ever. And they're like, what did you do? I'm like, you just opened some doors. We're just opening doors. That's it.
Absolutely. Absolutely. For sure. And we love supporting our patients, you know, through all the phases of their life, whether it's going from, you know, I want to train for a marathon, or I want to have a VBAC. Like that's one thing that we get a lot, because you guys probably hear it too, that, you know, oh, my doctor wants me to have a C-section because my baby's just too big. And they don't think I'll be able to push this baby out. And I'm like, your body's designed to do it, you know, and to some degree, like there's always that chance. But if we can help your body function better, your muscles function balanced from side to side, everything work appropriately, I don't see why you can't have a VBAC, you know? So it's really exciting when, you know, post delivery, moms are emailing me or texting me. They're like, I had my VBAC. And I'm like, that's so exciting for me. So, yeah.
Well, and I think unfortunately, a lot of people are also told, like, if they're having some like pelvic girdle pain or back pain or hip pain with pregnancy, people are just told like, oh, like it'll go away after pregnancy. Like it's just a pregnancy thing. And so people might not be seeking out like a chiropractor or pelvic floor therapist because they think it's like just something that's a result of pregnancy, and then they, baby comes and then that hip pain is still there, or that pelvic pain is still there. And
all the compensations.
Right. All the
Oh my
compensations.
gosh.
Yeah. And it's
Oh
like
my gosh,
after your body has a baby, it's not just like it just like goes back to how it was before.
Right.
So I think that's something important as well is, and I'll tell people too, where people are like, oh, was this caused by pregnancy? And I'm like, well, it's not. It's a lot of different things that sometimes there are things or compensations or imbalances that might have been going on in your body way before you were pregnant. Then with some of the hormonal changes and the postural changes with pregnancy, something that was just kind of like bubbling under the surface then comes to light. But it was, there might have been some things that were present before that kind of led to that. So just having the baby and not being pregnant anymore doesn't always mean that that's just going to go away.
Right. Absolutely. And no matter what we do sometimes with supporting our pregnant moms, there are just things that are outside of our control as chiropractors, as pregnant moms and things like that. So we just support however we can, whether it's educating, adjusting, being there emotionally. When moms are scared and they don't know what's going to happen, or what to expect with, if they're going to have a home birth or a hospital birth, things like that, we're just always there because there's always going to be so much unknown, and I don't ever want our pregnant moms to get frustrated or be upset when they have a delivery that they weren't almost planning, because things are just going to happen the way they go, and if you've done everything that you're supposed to, then you can't feel guilty. I actually, one of my really good friends who's a chiropractor, her husband is a chiropractor. She was planning a home birth and she got adjusted regularly. She did all of the things. She had midwives, doulas, all of the things. And unfortunately, she labored for like 55 hours, and had to have a C-section, and sometimes you just have to accept that, the health and safety of yourself and your baby is a little bit more important than forcing a home birth at times. So, so there's just some things, like even as us as chiropractors, things don't go the way we hope and expect, things like that. So,
and I think approaching it from what you were just saying, like educating, like from our end too, we sit and we talk so long with everyone. Like there's a lot more talking that's involved than just, let me place my hands on you and let's just fix it,
Right.
Because, and we know in research that, if pregnant women and pregnant people are given information up front and they know what's going to happen, like you cover this in your webinar, that like there's less grief and like trauma, like settling, I guess.
Oh yeah.
The correct terminology.
Well, I think, it was something of like a lot of people have the response of like, I didn't even know that this was something that could happen. So it does become more traumatic and harder to kind of process and grieve, because this wasn't even something that they ever considered as a possibility. So having kind of the knowledge going in, and not to like scare people beforehand of like, these are all the crazy things that can happen.
Right.
But I think, a lot of times, people are having a harder time emotionally because maybe, they're dealing with some pelvic pain or some incontinence or back pain or that sort of thing. And they were told that was going to not happen after like baby.
Oh yeah,
So,
absolutely. I mean, I honestly, I give every single pregnant woman, or almost any woman that comes into my office, your information, because they're like, well, this, and this. And, I had 5 kids. So like when I do jumping jacks, like I do pee a little, and I'm like, that's super common. It's not normal, but it's common. And I think we should kind of fix that too, because if there's a muscle weakness or, constriction that's causing those issues, imagine what the bones are doing. Like, our muscles attached to our bones, and if the bones aren't sitting properly, maybe that's what's causing, but also vice versa, So we always recommend whether it's pelvic floor or PT in any degree, because we work with the structures primarily, and you guys work with the muscles and ligaments more than we do. And so we always try to find that happy balance between getting, things structurally aligned and then your muscles functioning properly.
Mhm.
So
Yeah.
That's the beauty.
Yeah.
Why we
Yeah.
love working with you
Right.
and our other chiropractor friends in the area, and being able to communicate too. Like I know we've emailed or like, text or all the different things of, hey, or we have clients who come in and say, oh, I saw Dr. Stephanie and Dr. Stephanie worked on this and she asked if you could look at this. And I think that's a really great thing for anybody who's listening or watching to remember that, like, you're not just individually going to all these individuals, but continue to bring everybody onto the same platform of, you taking care of you. So to say like, hey, Dr. Stephanie, what should I tell Dr. Becca when I go see her today is really beneficial. And then vice versa. And we kind of like, whisper down the lane almost, what things need to be motivated or moving or sorted out.
Yeah, absolutely. And I love that the communication that we have between you guys and our patients and everything like that, because, we can only do so much. And then it's like, whatever I say, and then they go to you and they're like, oh my gosh, it clicked.
Yeah.
So like the verbiage and things
Right.
like that,
Such a great
the change
point.
in the verbiage and everything is,
Yeah.
so helpful. But then also to have, I truly believe the more eyes on a body, the better, whether it's another chiropractor, whether it's you guys, things like that. There's a lot of times within my office, I have to be like, Dr. Caleb, like their body is not speaking to me. I can't see, I can't feel. And he'll step in and he'll be like, oh, it's this, for sure. And so we absolutely work hand in hand with so many different people, other practitioners, things like that, because my eyes, my hands can only feel so much, so.
Yeah. When I can think like just off of the top of my head, like one client who we share, and she'll come in and she'll be like, oh, like I saw Dr. Stephanie yesterday or whatever, and we worked on this, this, and this. And then as I'm looking at them, I'm like, well, tell Dr. Stephanie she did a great job.
Exactly.
Because, like, things are feeling great,
Yeah.
So, and they're like, I feel so much better. And then they'll come in and it's like, okay, it's honestly awesome, because it's almost like we're helping each other in a way. We're making each other's jobs easier, because it's like, they saw you were able to clear up these things. So then now it's easier for me to kind of just focus on like, okay, whatever's left, or vice versa, where like they'll see me and then they go to you, and it does kind of make our jobs easier. But I can think of this one client where I'm like, well, tell Dr. Stephanie she did a great job, because
That's
your
awesome.
pelvis feels great, or whatever. I cannot remember what it was that she said you guys were working on, but I was like, like, great,
of course,
great, wonderful.
That's so awesome to hear, for sure.
Yeah.
Cool.
So I feel like a question that we get a lot. So I mean, you said during pregnancy, safe to see a chiropractor like at any point. What about postpartum? That's a question that we get a lot, as far as people who maybe are coming during their pregnancy and do want to follow up postpartum. Is there a timeline that you generally follow for that?
So we don't specifically. I mean, there are times where I've been called and they're like, I've been in labor for 20 hours. Can you come? So like coming to a patient's home and making sure just like all of ligaments, all of that is aligned and functioning properly, and that, maybe their body just needs more time to labor, or if there is something restricting baby from descending to where baby needs to be to help labor progress. But then also after that, like we let patients kind of feel their body. There are times where I've had, patients come in 2 days after delivery and they're just like, I need it. My baby needs it. Like my body just went through something so traumatic.
During
Right. Yes,
or
absolutely.
How you pushed a lot of times, like if you're in that one position pushing for like an hour or that sort of
Oh my gosh, the poor sacrum.
Yes.
Oh gosh, yeah.
So, but yeah, so we really just let moms kind of feel their body, feel like when they feel comfortable, one, leaving their house, especially with, everything that we've gone through in the last few years as a country, as a world, when they feel safe and comfortable leaving their home, but also like physically, do they feel comfortable moving their body that much, like getting into a car, carrying a bait, all of that, with whatever their situation is. So we typically let them stay, but I try to guide them within a 4 to 6 week period. I really want to see your body's done a lot of healing, unless there's like very traumatic things that happen. But like I said, I let patients kind of tell me when they're ready to come in, but I always say, educate them on the importance of coming post delivery and everything, just because of how traumatic, no matter how beautiful your birth is, it is still traumatic on your body and your baby.
Yeah, I would say we're pretty similar as far
exactly.
as, obviously, as far as like pelvic floor muscle evaluation, we wait, whatever the time frame is for the healing to occur. A lot of times it is that like 6 week time frame.
Sure.
But we encourage people to come in if they're ready to come in at 2 weeks, 4 weeks, like come on in. The sooner that we can kind of start to facilitate the body's natural healing process, like, the easier things are gonna go, because the body, it does heal itself, like that, and I think
100%.
that's one of the biggest things that I try to reiterate with our clients is that, like, look, I'm not doing anything that's like fixing or adjusting or whatever. We're just influencing your body to allow it to do what it knows how to do. Sometimes we might be doing things that are like hindering that or slowing that down. So we're trying to do more of the things that facilitate that. And the sooner we get started on that, a lot of times the easier, the quicker, the faster people are able to be feeling a lot better.
Definitely.
Oh, absolutely. Everything you just said is like spot on. And I love when I see almost like the light bulb of like, oh my gosh, our bodies like do heal itself.
Yeah.
And like sometimes we'll like throw that little analogy of like, when you get like a paper cut, you literally don't have to do anything. Your body will fix that, and it's the same for literally every inch of everything you are. And so it's exciting when people start to see that, or, they were coming pretty regularly for whatever reason. And then they, get onto maintenance care and like, you know what, I did have a flare up, but it didn't last as long and it wasn't as intense. And, I think whatever we were doing, has made that happen. So it's really exciting when patients kind of put those two and two together and realize just what an incredible, mechanism their body truly is.
Yeah.
So intelligent.
Well, and I think, as practitioners, like we kind of mentioned earlier, like we're looking head to toe. I feel like a lot of times people, because we're pelvic floor therapists, they're like, I don't know if you like do this, but like my shoulder's been bothering me, or like my back hurts from like, breastfeeding. I'm like, we're still physical therapists and chiropractors at the end of the day. Like we understand the entire body, and it's all connected. Like your jaw pain is definitely connected to your pelvic pain.
100%.
So yeah, let's work on your neck. Let's work on your jaw. I had one client who was like, wait, you can do that? Like, can we do that today? And I was like, yes.
Yeah.
So,
I definitely experienced that a lot too, where patients, like regular patients who've been seeing us for like 3 years, and they'll like come in and be like, Dr. Steph, I think I have to transition to you now. And I'm like, why? And it gets really exciting for me. Or like when patients kind of bounce back and forth because they're like, you know what? I know whatever you did to this helped me. And so that's why I love having another chiropractor in my office, because, every stage of anybody's body life needs something. And so whether it's something that I can help them with, or whether Dr. Caleb can help them with, whether it's what you guys can help them with, that's why I truly love like having a team. And especially with pregnant women, with everything their body goes through, really talking at the beginning about their birth plan and who's on their team and who's there to support them and all of it. Because, especially new moms, they're like, I don't know anything. And I'm like, okay, let's talk about who's going to be here for you, mentally, physically, all of it, so.
That's beautiful.
Yeah.
All right. Well, so talk to you about like if people are watching this and want to work with you or listening, what's a great way to kind of be able to reach you, how people can get in touch or find your information.
Yeah, absolutely. So probably the easiest way is our website, which is njdynamicchiro.com. That has all of our information, any extra research. If you're questioning what what to do or who to see, whether it's myself or Dr. Caleb. Because like I said, we see all stages of life. And, so if you're a mom and you've got an athlete child, we will see that too. But from our website, has all our information, but also has, we have an online scheduler there. So it makes it super easy for people to kind of hop on, whether they're a new patient, kind of see what works with their schedule, but then also last minute, if they're like, oh my gosh, I need something today, absolutely hop onto our online scheduler, or you could just give us a call. But we also have all of the fun social media things that we kind of try to help educate our patients with too, which you can find on our website.
Awesome. Yeah, and you guys are in Morristown, which is just like 20 minutes up the road from us, so it's great.
Yeah, I will say it is a little tricky to find our office. So we are up near like the Wegmans Costco shopping plaza, but like on the other side of it. So if anybody ever gets lost, just give us a call. We'll kind of give you some landmarks to kind of look for, because we are kind of tucked back in a plaza.
Gotcha.
That's awesome to know, though.
Yeah.
Great. Well, thank you so much for joining us. We'll have to have a separate one that talks about all your like pediatric kind of chiro. 'Cause I
Oh,
feel
yes.
like that's
That's
a lot of times
big-
people, are like, what? Another thing that chiropractors do that people aren't aware of. So
Absolutely. I would love to join you guys in that
yeah.
conversation.
All right, Dr. Stephanie.
right.
Well, thank you so much for joining us and sharing all of that lovely information.